Hello, everyone out there. Welcome to Facebook Live presentation on infertility. My wife and I are business, food nutritionist, and West Coast will be making an attempt on infertility and food nutrients that support fertility. Now we'll start by asking us a question. What is infertility? Now, infertility means not being able to get after at least 1 year of trying, or get pregnant and having repeated miscarriages is also termed infertility. Now, kinds of infertility. Infertility is of two kinds. We have primary infertility, that is if pregnancy has never been achieved with consistent trying, and also the secondary infertility, where there are miscarriages after getting pregnant. Now, the chains of events that could lead to pregnancy. For a woman to conceive, the following event must take place. Number one, the release of viable eggs from one of the woman's ovaries. Number two, egg must jump through the fallopian tube to the uterus. And then number three, sperm from the man must fertilize the eggs along the way. Number four, fertilized egg must be embedded in the lining of the womb, which is known as implantation. Now, any problem interfering with the above steps automatically leads to infertility. Now, how common is infertility? How common is it? Most women today experience challenges or difficulty in getting pregnant. The reasons we are going to look at. Now, causes of infertility in women. Mama, what do you have to tell us about that?
The cause can be due to the problem in the woman called infertility, or due to cause in man is called male infertility, and can equally be due to the cause in both. When it is in both, it's called combined infertility. When both couples are normal after due medical examination, it is referred to as idiopathic infertility or infertility of unexplained origin.
Now, causes in men could be as a result of inadequate spermatozoa, or reduced or no sperm production at all, abnormal shape and structure of the sperm, sluggishness or non-mobility of sperm. It could equally be as a result of unhealthy diet. Now, factor that aids fertility in man. Number one, alcohol intake. Alcohol does not contain any nutrients, and the body at every given time needs nutrients to maintain the balance. Excessive use of tobacco, that is smoking, poor diet, emotional stress, health problems, age, drugs, all of this can lower sperm count, raise temperature in the scrotum due to tight underwear. Then environmental factors. Environmental toxins including pesticides and lead, medicines, e.g. ulcer drugs, antihypertensive drugs such as aspirin, and anti-malaria drugs. Now, the causes in women.
The problems with women, as the problem with ovulation, are common. That is, failure of ovulation, known as anovulation. 2. Blockage of fallopian tubes caused by infection or surgery. Then 3. Abnormal shape and position of uterus, fibroid age, stress, poor diet, caffeine, athletic training, weight, either overweight or underweight, health problems that cause hormonal challenges, tobacco smoking, medical such as traumatism, then unhealthy diet. This could cause infertility in women. Then there's something we have, that usually most men have that can cause infertility, and that is fibroid. And fibroid is benign tumor of fibrous and muscular tissue, one or more of which may develop in the muscular wall of the uterus. The fibroid often cause pain and excessive menstrual bleeding, and they may become extremely large. They do not threaten life but render pregnancy unlikely. It is usually women of 30 years of age who are affected. Apart from very few causes which are congenital, others are required, many a times as a result of infection, namely sexual transmitted infection, STDs, criminal abortion with ignorance as the catalyst. About 78 of infertility cases are secondary types, which are most often caused by infection with ignorance as catalyst both in men and women. Therefore, suggestion is directed to the grassroots.
Now, when planning to have a child, it is advised to know as much as possible about the best condition for conception. Now, if after 12 months of trying and conception have not taken place, both partners should visit a health practitioner and also look into their lifestyle, because lifestyle could be responsible for it. Now, you go for medical check, general state of health, your sexual history, check for infections. Timing of intercourse is very important also. You will have to check for fibroid case. Test to ascertain the position of the uterus. You check for potency. Check for menstrual flow, stroke, ovulation.
Right, in terms of the timing of intercourse, I usually advise most women, because we are known to have meet at least at night to, in terms of intercourse, but sometimes I advise most women meet during the daytime. Try to meet during the day, and you will see things will change. Ovulation. This is the process in which egg ripen, release and migrate into a fallopian tube. This occurs 14 days before the beginning of each menstruation period. After ovulation, the ovary produces the hormones known as progesterone, which alter the endometrium or lining of the uterus and the consistency of the muscle in the cervix. The process of ripening and release of the egg is detected by scanning. If the reason for infertility is due to non-ovulation, treatments may be given to stimulate ovulation.
Now, what could be some of the nutrients that empower fertility? Now, we need the folic acid, which is very vital for cell reproduction. We need vitamin C, important for sperm production. And then vitamin E, that is sex vitamin that increases sperm count. And then zinc, highest concentration in the prostate is zinc. And if the prostate is not intact, then of course fertility for men is almost zero. Then essential fatty acid, amino acid, arginine, lysine, manganese is very important for sex hormone production. Then vitamin B5 maintains sex hormone. It also helps against stress. Now we'll be looking at some of our products that contains the nutrient that will help for fertility. Number one of them is the aloe vera gel. Aloe vera gel is a general body tonic that replenishes lost vital nutrients. One thing that causes infertility in both men and women is lack of vital nutrients that empowers fertility. And then the next one is the berry nectar. Okay?
The berry nectar has all the goodness of the aloe vera gel. It cleanses the entire urinary tract infection, because one of the problems too that has to do with infertility is infection. So the berry nectar helps to cleanse urinary tract infection.
Now, what other product can we identify? The bee pollen. Yeah, that is bee pollen. Bee pollen helps to correct body chemistry, counteract the effect of food additives and preservatives. All of those things, additives, preservatives in food, can kick against fertility. Many of us don't know this. We just apply all kinds of things into what goes into our mouth. And that is the major reason why more than 50% of people today are suffering from infertility problems. Okay, now it is naturally high source of zinc and vitamin B5, beneficial for depression, premenstrual treatment, and also for fertility. Okay, now we can talk about another one, the royal jelly.
Royal jelly, that's the royal jelly. The royal jelly balances hormones. It is vital for both male and female infertility. Uses 1 to 2 tablets under the tongue twice daily.
Okay, now we'll talk about the ginger. And that is the ginger. The ginger is a powerful antioxidant. Very powerful, so it fights against oxidation and thus put to an end the build-up of free radicals. Okay? Number 2, it can help to increase stamina and endurance. Help support healthy circulation, strengthen the reproductive glands, and also enhances immune function. So now, what other product can we share with us that contain nutrients for fertility? That is the multi-marker. Multi-marker is a product that increases fertility in both sexes, both husband and wife, man and woman. And marker removes problems of menopause and andropause. So, what other one can we share with us?
We have the A-beta care.
It's okay.
The A-beta care, very useful to man's and women in fertility. Stimulates sperms production and then supports healthy blood circulation.
Now, we equally have the B12, the B12 folic acid.
The B12 folic acid, very good for the fetus during the first 3 months of pregnancy. Also beneficial to women wishing to conceive, like the expectant mothers, the lactating mothers, and the pregnant women.
Now we equally have the Vitalize for men and Vitalize for women. The Vitalize for men is very good for optimal prostate health, highly beneficial for the production of male hormones, and also enhances the male sexual libido. Okay, now what can we talk about the Vitalize for women? We equally have that also, Vitalize for women. Now the Vitalize for women also enhances fertility in women. That is just it. The Vitalize for women enhances fertility in women. Okay? Now the Vitalize for women
is a nutritional support for hormone and mood balance. Supports healthy reproductive organs, natural aphrodisia, helpful supplement against discomfort due to premenstrual syndrome, and then also optimal. It helps for urinary tract infection. The Vitalize for women is a very important a product that all women should have in their shelf.
Now it is equally very important for every one of us out there to help ourselves with this product that we are sharing with us, because there are so many people out there that are suffering from this problem of giving birth, getting pregnant. And so we are believing that with this little video that we are sharing with us, many of us out there will equally help to reach it out to people out there, because we all are looking forward to rejoicing with all of the expectant mothers out there. Okay? Now we want to thank every one of us, and we urge you to like and share this video to help others achieve their dreams. Thanks for viewing. Thank you.